cases of COVID-19 in Canada, including 9,200 deaths. 87% of people have now recovered, and labs across Canada tested an average of 47,111 people daily over the past week, with 1.4% testing positive. Yesterday, a total of 1,120 cases were reported across Canada. However, only 872 of these cases were newly identified yesterday. Due to a reporting backlog in Quebec, 248 of the cases are from cases identified earlier in the week. With the inclusion of these backlogged cases, an average of 849 new cases have been reported daily during the most recent 7 days. The ongoing increase in the national daily case counts is an indicator of accelerated epidemic growth. This situation increases the likelihood that we could lose the ability to keep COVID-19 cases at manageable levels. Now is the time for Canadians to redouble their efforts with personal precautions that will slow the spread of the virus. I urge everyone to consistently follow proven effective measures for controlling the spread of COVID-19, including maintaining physical distancing, hand washing, and wearing non-medical masks where appropriate. As always, the most important measure is to stay home and away from others if you are experiencing any symptoms, even if mild. By following these measures, you can keep yourself and your loved ones safer, while helping to protect people in our communities who are at high risk of severe illness due to COVID-19. Your actions can have a direct effect in reducing transmission in your community, which will help businesses, schools, and public facilities stay open. I also want to acknowledge how the last few weeks have been a time of change for many Canadians. School-aged children and their caregivers have adjusted to new routines, new teachers, and new ways of doing things. And for many, this has not been easy. Parents, caregivers, and educators are watching the increase in case numbers with concern. We can support them, as well as children and students, by following the advice of local public health authorities to help keep COVID-19 out of schools. We've come too far and lost too much to give up now. Let's reconfirm our commitment to work together and redouble our efforts to keep COVID-19 at manageable levels. Thank you.
Bonjour.
Good
Il y a
day.
eu 140
There have been
167 cas de COVID-19 au Canada,
140,867
dont
cases of
9
COVID-19
200
in
décès.
Canada, including
87%
9,200
des
deaths.
personnes sont maintenant
87%
rétablies.
of people
Les
have now
laboratoires du
recovered.
Canada ont fait
Labs
l'analyse
across
des
Canada
tests de
tested an
dépistage de
average of
47 111 personnes en moyenne par
47,111
jour au
people
cours de la
daily
dernière
over
semaine,
the past
dont
week,
1,4% a reçu un résultat
1.4%
positif.
testing positive.
Hier, un total de 1,120
Yesterday,
cas ont
a
été
total
signalés au
of
Canada. Cependant,
1,120
que
cases were reported
872
across
de cas
Canada.
ont été
However,
signalés
only
hier. En raison d'un
872
retard de
of these cases
déclaration
were
au
newly
Québec,
identified yesterday.
248 des cas proviennent
Due
des
to a
cas
reporting
dépistés plus
backlog
tôt
in
dans
Quebec,
la semaine.
248 of
Compte
the
tenu de
cases
ces cas
are
dont la
from
déclaration
cases
a
identified
été
earlier in the
retardée,
week.
une moyenne de
With the inclusion of
449
these
nouveaux cas
backlogged
ont été
cases, an
signalés
average of
quotidiennement au cours
849 new
des 7
cases
derniers jours.
have been reported daily during
L'augmentation
the most recent
constante du
7
nombre
days.
quotidien de cas
The
à
ongoing
l'échelle
increase in the
nationale
national
est un
daily case
indicateur
count
de
is an
l'accélération de la
indicator
croissance
of
de
the
l'épidémie.
accelerated epidemic
Cette
growth.
situation augmente la probabilité
This
que nous
situation
ne
increases
puissions
the
plus maintenir
likelihood
le
that
nombre
we
de cas
could
de
lose the
COVID-19
ability to
à
keep
un niveau
COVID-19
gérable.
cases at
Le
manageable
moment est venu
levels.
pour les Canadiens de
Now
redoubler
is the
d'efforts
time for
en prenant
Canadians
des
to
précautions
redouble their
personnelles
efforts with
qui
personal
ralentiront la
precautions
propagation du
that will
virus.
slow the spread of
On
the
demande
virus.
instamment à chacun de
I
suivre
urge everyone
systématiquement
to
les mesures
consistently
qui ont
follow
fait leur preuve
proven
pour
effective
contrôler la
measures
propagation de
for controlling the
COVID-19,
spread
notamment
of
en maintenant
COVID-19,
une distance physique,
including
en se
maintaining
lavant les
physical
mains et
distancing,
en portant des masques non
hand-washing,
médicaux
and
de cas
wearing non-medical
échéants.
masks where
Comme toujours,
appropriate.
la mesure la plus importante
As
est de
always,
rester à la
the most
maison
important
et à
measure is
l'écart
to
des
stay
autres
home
si vous
and away from
présentez des
others
symptômes,
if you
même
are
faibles.
experiencing any
En suivant
symptoms,
ces mesures,
even if
vous pouvez
mild.
vous protéger et
By
protéger vos
following these
proches
measures,
tout
you
en
can keep
contribuant
yourself
à
and your
protéger les
loved ones
personnes de nos
safer while
communautés
helping to
qui
protect
courent un
people
risque
in our
élevé de
communities
tomber
who
gravement
are at
malades
high risk
si
of
elles sont
severe
atteintes de
illness
la
due to
COVID-19.
COVID-19.
Vos actions peuvent
your
avoir un effet
actions
direct
can
sur la
have a direct
réduction
effect
de la
in
transmission
reducing
dans votre
transmission
communauté,
in your
ce qui
community,
aidera les
which will
entreprises,
help
les écoles
businesses,
et les
schools,
installations
and
publiques
public
à rester
facilities to
ouvertes.
stay open.
On tient également à souligner que
I
ces
also
dernières
want to
semaines ont
acknowledge
été
how the
une
last
période
few
de
weeks
changement
have been a time
pour
of
de nombreux
change
Canadiens.
for many
Les
Canadians.
enfants d'âge scolaire et les
School-aged
personnes
children
qui s'occupent
and their
d'eux se sont
caregivers
adaptés à des nouvelles
have adjusted
routines,
to new
à des nouveaux
routines,
enseignants,
new
à des nouvelles
teachers,
façons de faire
and
des
new
choses.
ways of doing
Et pour
things.
beaucoup de gens,
And
cela
for
n'a pas
many,
été facile.
it has not been
Les
easy.
parents, les personnes qui s'occupent
Parents,
des enfants,
caregivers,
les éducateurs
and
suivent avec
educators
inquiétude
are watching the
l'augmentation de
increase
nombre
in
de
case
cas.
numbers with
Nous pouvons les
concern.
aider,
We can
ainsi que les
support
enfants et
them
les étudiants,
as well
en
as
suivant les
children
conseils
and
des
students
autorités
by following
locales de
the
santé
advice of
publique
local
pour
public health
éviter que la
authorities
COVID-19
to
ne
help
soit
keep
transmise à
COVID-19
l'école.
out of schools.
Nous avons accompli trop de choses,
We've come too
nous en
far
avons perdu
and
trop
lost too
aussi
much to
pour
give up now.
abandonner maintenant.
Let's reconfirm
Réitérons notre
our
engagement
commitment
à travailler
to
ensemble
work together
et redoublons
and
d'efforts pour
redouble our
maintenir le
efforts
nombre de
to
cas
keep
de
COVID-19
COVID-19 à
at
un niveau
manageable
gérable.
levels.
Merci.
Thank you.
Thank you, doctors. We will now open the phone line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking questions in the room, we ask that you make your way over to the freestanding mics. We'll start on the phone as usual. Operator, over to you.
Thank you. Merci. As a reminder, please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question est de Émilie Bergeron de l'agence QMI.
Question from Emily Bergeron from QMI.
Oui, bonjour, Dr.
Question.
New et
Hello,
Dr.
Dr.
Tam.
New and Dr. Tam.
La santé publique d'Ottawa dit qu'on
Ottawa
est
Public
présentement dans la
Health
deuxième
says that we're
vague.
currently in the second
À
wave.
l'échelle canadienne, est-ce on peut dire qu'on est
Across
dans une deuxième
Canada,
vague?
can we say that we are at a national second
C'est
wave?
Dr. New, merci pour la question. Je
Answer.
pense en effet
This is
c'est
Dr.
difficile
New.
pour
Thank you for the
prononcer pour
question.
qu'est-ce qui se passe à travers
I
tout le
think it's
pays.
difficult to
Il y a
say what's
toujours une
happening
réalité,
right
une
across the
situation
country.
épidémiologique qui est différente, qui
always
varie d'une
an
région à l'autre. Ce que
epidemiological
Dr. Etches
reality that varies from
constate,
region to
selon
region.
les données
To date,
et la
we
situation
are observing the
épidémiologique
following.
à Ottawa, peut-être que c'est différent avec ce qui se passe actuellement,
In
peut-être
Ottawa, there's the second
au
wave,
Yukon.
but
Donc,
that
je
might be
pense que c'est
different from what's
difficile pour
happening in
nous
the
autres
Yukon.
de déclarer
So it's difficult for
en
us
général qu'est-ce qui se passe actuellement
to
pour
make
tout
a
le pays.
statement about what
Mais
is
ce qu'on
happening
voit,
generally across
et
the
ce qui est
country.
inquiétant, c'est qu'il y a une augmentation de
But what
cas
is concerning
un peu
is that
partout
cases
dans
are
le pays.
increasing,
C'est sûr,
and
il y a
that is
quelques
right across the
provinces,
country.
par exemple, dans les provinces d'Atlantique,
At the same time,
qui
there
n'ont
are
pas
some
beaucoup de
provinces,
cas,
for
mais
example,
dans
Atlantic
les grandes
provinces, that
provinces
don't have
comme la
very many
Colombie-Britannique,
cases,
Alberta, Ontario,
don't have as many
Québec,
cases as
on voit
bigger
avec
provinces such as
inquiétude
BC,
une
Ontario, Quebec.
augmentation des cas pendant plusieurs semaines. Donc,
We
je pense
have
que
been observing an increase in
peut-être un
cases
peu
for the last number of
trop
weeks.
pour déclarer c'est comme
It is
une
a
deuxième
bit
vague,
too
comme Dr.
early
Etches a dit pour
to
Ottawa,
declare
mais
a
c'est sûr
second
que
wave,
l'augmentation, c'est une tendance
but the increase is the
qui
trend
nous inquiète.
that is
Thank you, Doctor.
concerning
And
us.
for everyone's interest, would you mind repeating that in English as well, please?
Dr. Etches has said that there's a second wave here in Ottawa, and certainly I respect what she's saying because she obviously has the information, the statistics, the data, what's happening at a local level in Ottawa. I think it's difficult for ourselves to say at a national level if we are, quote, in a second wave or a resurgence overall in the country because the situation does differ from one area of the country to another. But what we are seeing is that certainly in the four biggest provinces, British Columbia and Alberta and Ontario and Quebec, that the case numbers have been going steadily, up and increasing for quite a number of weeks, and certainly that's concerning. But at the present time, there are parts of the country that aren't having a lot of cases. For example, in the Atlantic provinces, and so. Taking all that into account, it's difficult to say that overall in Canada that we are, quote, in a second wave, but certainly we're going to be following closely, and we are, I think, everyone's concerned about the ongoing increase or the, I would say, the trend is going the wrong way.
Thank you, Doctor. Émilie, question suivie?
Follow-up question?
Oui, bien sûr. Justement,
Yes, I have a
je
follow-up.
comprends qu'on peut pas. La situation varie d'un endroit à
So I
l'autre,
understand that the situation varies
mais
from one
les
place to
règles pour les
another,
rassemblements
but the rules
intérieurs et
regarding
extérieurs
indoor
sont
and
différentes d'une province à l'autre.
outdoor
Donc,
gatherings
qu'est-ce qu'on peut faire pour que les gens
seem
s'y
to be
retrouvent?
different from
Par
one
exemple,
province to
entre
the other.
Ottawa et Gatineau,
So what can we
c'est pas la
do?
même chose. Donc, qu'est-ce qui pourrait
In
être fait pour
Ottawa,
que les
the
gens
rules are
se
different
retrouvent
to
à
what they are in a
travers
different city.
différentes possibles deuxièmes vagues?
So what can we do in the face
Oui,
of this
je pense que,
possible second
merci,
wave?
c'est Dr. New encore. Je pense que
Answer.
c'est très important
Thank
pour
you. This is Dr. New
tout le
again.
monde, la
I think
population
it's very
générale, de
important for
vraiment
everyone, for the
suivre les
general
consignes
population,
des autorités de
to
santé
closely
publique
follow
locale parce que
the advice
c'est
of
vraiment
local
dans
public health
votre
authorities.
quartier, votre région, les autorités
Because the authorities in your
savent
region
exactement qu'est-ce qui
know
se passe
exactly
avec la
what is
situation
going on
épidémiologique. Et s'il
with
y a
regards to the
vraiment des
epidemiological
sources, des
situation.
événements ou une tendance
And if there are trends, sources,
on peut
etc.,
peut prendre des mesures
at play,
de plus,
measures can be
peut-être
taken.
ajuster les mesures dans,
Further
par
measures,
exemple, les
for
bars ou les
example,
restaurants. Je sais qu'est-ce qui se passe au Québec. C'est
tightening
vraiment pour les
restrictions in
autorités
bars and
à
restaurants.
l'échelle locale. Je pense
It
pour
really
la
depends on the
population en
local
général,
situation.
ce sont les mêmes les bonnes
When
mesures
it
de
comes
santé
to the
publique qu'on a
general
soulignées
population,
plusieurs fois.
I think
C'est
we have
toujours
outlined
la
good
distanciation
public health
physique,
actions
la
many
bonne
times.
hygiène
Proper physical
des mains,
distancing, good hand
l'utilisation
washing
de
hygiene,
couvre-visage, rester à la maison
wearing
si
a
on
facial
est
cover, a face
malade. C'est vraiment
covering,
les
staying
mêmes
at home
choses.
if you feel
Mais
sick.
je pense qu'une autre,
They are really
chose
all the
peut-être
same
je peux
measures.
souligner, c'est
But
intéressant
I
parce
would
que tout
point
le
out
monde,
another
c'est
thing.
toujours quelque chose un peu sensationnel. C'est dans les nouvelles. Si il y a
Something we have been seeing
un
in the
événement
news
comme une grande partie, une fête à l'intérieur ou qu'est-ce qui se
is
passe
that
avec
there
les
have been
bars et
large
restaurants. Mais
gatherings or
chose
parties
peut-être aussi
indoors.
très important, c'est beaucoup
And
de
something important
personnes
in that
atteintes
regard
avec la COVID-19,
is that many
ils ont les bonnes
people
intentions et c'est pas à cause
have
d'une
been infected with
grosse partie à
COVID-19
l'intérieur qui se
had
sont
good intentions.
contaminés. C'est vraiment quelque chose à suivre parce qu'on ne veut pas avoir, comme on dit, la stigmatisation et
We don't
discrimination
want
des
to
personnes.
discriminate and we
On veut
don't
vraiment
want to create
encourager
any stigma.
n'importe qui si on est malade ou
We want
peut-être
to
on inquiète, peut-être on est atteint avec la COVID-19,
We understand that
on est
people are
identifié comme un
worried
contact. C'est très
about being
important
infected with
d'aller
COVID-19.
sans être gêné pour un test.
So if you
Merci.
have any concerns, it's very important to go and
Merci,
get
doctor.
tested. Thank you.
Operator, next question.
Merci. Thank you. Our next question is from Christy Kirkup from the Globe and Mail. Please go ahead.
Good morning, doctors. Thank you very much for taking these questions. I know that you have been asked in recent days about the very long lineups that we're seeing in different parts of the country in order to get access to testing. I'm wondering if there is concern on the part of federal public health officials that these long lineups are going to serve as a significant deterrent for people going to get a test because it could take many hours for them to get through those lines.
Yeah, thank you for the question. And because we're not at the local level, I can't say how many spots there are in terms of the lineups. You see them on the news, but you also don't necessarily see the places where things are actually working quite rapidly. So I think just to bear that in mind. But yes, I mean, I certainly want to thank everyone who is lining up patiently to get tested. And I think we've heard, particularly from the province of Alberta and Ontario, a reminder now that we need to make sure people who have symptoms, even if you're mild, people who are actual contacts or have exposures are the ones that need to get these tests, not just if you're sort of the word well. So that's very important for making sure that the testing clinics are prioritized for those kind of groups. Of course, they are actively monitoring any outbreaks and testing contacts, even in asymptomatic in those kind of contexts. But I think we still, though, really encourage people to get tested because that's how you're going to detect the initial cases and to break the chains of transmission. What is good news? I mean, having heard about some of these lineups, we went back just to check on the capacity of the province and territories. And it's great news that the capacity is still being increased, and it is now approximately 90,000 tests that across the country provinces can do. That doesn't mean, though, at the local level, there are certain spots where there may be some logistical and other issues that they need to deal with, but that capacity is not stopping. That is still continuing to increase. And so I think that's one aspect of it. But I do think that if you do have symptoms, if you're a contact, if you got notified through an app, all of those things are very, very key reasons why you should take a bit of patience and line up as well. Thank you.
Thank you, Doctor. Christy, follow-up question?
I'm just wondering about the I'm wondering, what extent are you worried that COVID-19 carries a stigma in Canadian society right now?
Well, I think there's been a number of sort of information sources, including a Statistics Canada survey. I think that was a cloud-based survey, but it sort of reinforces the fact that, yes, there has been stigmatization of racialized populations and different ethnic groups. Certainly the people who volunteered to respond to those surveys have signified that there's been an increase in that kind of stigma and discrimination. I think what I will urge everyone to remember is that we do know that there's differential impact and health equity impacts on certain racialized, ethnic, and socially, economically disadvantaged populations that we've seen. I mean, you've seen the Toronto sort of sub-population data. It's because many of these groups are our essential service workers, our personal support workers. People must continue to work, and they may have a higher risk of exposure. They may be living in congregate living settings where they can't manage the distancing as much as possible, and there's access to care issues as well, people in low-paying jobs. So, I think it's something that we're absolutely, as a collective in society, need to be conscious of, and that someone who tests positive, who's in these groups, should be commended for actually getting the test. And it's an important thing to do. It's a brave thing to do because it really helps the community. And we need to support people in those settings to be able to take sick leave, to be able to stay at home. But it is a very real issue that I think we need to, each one of us as individuals and community needs to reflect on. Thank you.
Thank you, Doctor. Operator, next question.
Thank you. Our next question is from Cassandra Skorsky from the Canadian Press. Please go ahead.
Hello. I guess this is for Dr. Tam. We're seeing two different responses to the case spike from Ontario and Quebec. Ontario seems to be more targeted on individual behaviors with new limits on indoor and outdoor gatherings, while Quebec will crack down on establishments. Where do you see the main gap in containment, and how do shortcomings in each area influence overall vigilance? And I'm wondering, are we at the stage now where we can no longer rely on individuals to maintain necessary precautions without mandating and active enforcement?
I think there's many different combinations of measures that we've learned, in the last months that can work, but individual behaviors are very, very important. So supporting people in I think societal cohesion and making sure our populations understand how important it is to keep up with those public health measures, and that each one of us can make a difference. Every action that we make, every layer of protection we keep up with helps stop transmission, helps break chains of transmission, and that it continues to be extremely important. I know that according to different data, locally, people might institute different measures in terms of establishments or workplaces or businesses. And the idea across the country, as I discussed with chief medical officers, that they will try to be as targeted as possible, not as blanket as approach as we had to do at the beginning of the initial wave, where we knew very little about the virus. Now there's more data. If the data in a certain area of the country is showing that it is restaurants or bars or nightclubs, that's where the targeted action will take place. But everywhere across this country, the public will continue to play a massive role. And I know that there are deterrents and there are fines that some local jurisdictions are using as another measure, but that does not substitute for, I think, making sure, just like in the first wave, that everyone in this country stick to what is tried and true and works. The other thing is that you've seen, I think in Ontario, and back to the question about Ottawa, they've spotted 3 cities or 3 regions where things in terms of rates of cases have gone up, and they've now reduced the size of gatherings, for example. I believe, and you should check it with Ontario, but I believe that also applies to indoor and outdoor gatherings. So they are trying to titrate their public health measures to where the hotspots are. So you're going to see more of those tailored approaches. But yeah, people are going to try both. They're going to try to look at reinforcing certain policies, but we can never let go of improving, enhancing, and supporting the general public in playing their part. Thank you.
Yeah, it's Dr. New. Maybe I just add a point to that. I think that we made the point previously at press conferences is that there's certainly things that governments can do, both at a local level, provincial level, and so on, in terms of big regulations and enforcement and so on. But at the end of the day, it really does come down to a sense of personal responsibility. Every Canadian knows what to do, I would hope now, in terms of the measures they can undertake themselves. And so it's just a matter of us maybe looking in the mirror and seeing what it is that we could or should be doing in our daily lives, who we interact with, how we conduct our day-to-day activities. And I think that's how we're going to beat this virus. Thank you.
Thank you, doctors. Cassandra, follow-up?
Yes. The U.S. recently released its distribution plans for the day a safe and effective COVID vaccine is available, including assurances would be free and that priority groups would get it first, and mention of, I think there was also mention of need for special distribution chain to handle, refrigeration or freezing. So what is Canada's plan and what guidance is being prepared for vaccine distribution?
Yeah, Canada, has very, very comprehensive approaches to the whole vaccine implementation, and you're going to see us communicate that as the weeks go by. But we are, getting ourselves ready for if the phase 3 clinical trials yield good results in terms of the safety and the effectiveness of the vaccine. So some of the preparations underway includes working with the provinces and territories. We already have well-established mechanisms for all vaccines in general, but this is bigger and more challenging than any vaccine program we may have to roll out. So working very closely with them because they're the ones deploying the vaccine and the program. We're also leveraging the National Advisory Committee on Immunization. That is a committee of experts that will advise based on the data of the epidemiology of what we will see in terms of the data available from the clinical trials. But we're already working on different scenarios, but definitely looking at priority groups in terms of certainly people who might be at high risk, people who may transmit to those at high risk, etc. So all of that work is underway, and there'll be more to come. The Vaccine Task Force, of course, is involved with advice on the products and the acquisition. We are also enhancing, strengthening, looking at all of our vaccine safety monitoring, surveillance systems, our researchers who can, supplement the whatever the manufacturers have in but the post-marketing surveillance of vaccine effectiveness, uptake, and safety. So all of those things are underway, but it is, you will see more communication to come. There's more engagements to come. But I think the bottom line, though, is that you have to see what some of those vaccine clinical trial data is like. And anything that we potentially put out will be interim until we can readjust yet again with the data that is made available. And we are also looking at vaccine supplies, be it needles, syringes, and vials, and all those things being queued up so that we can be ready.
Thank you, Doctor. We will now turn over to the room. First question in the room, let's start with the CBC News.
Hi, this question is for Dr. Tam. I'm just wondering if you can, David Thornton, CBC News. I wonder if you could walk us through what special actions have been taken this year that's different from other years to ensure that not only that there's enough supply of the influenza vaccine, the flu vaccine, but also that it will get to as many people as possible, because one would imagine the system right now is very consumed with addressing COVID-19, and you could have as much vaccine as you want, but if you don't have people to administer it, if you don't have the infrastructure to do it safely, that would be an issue.
Yes, so certainly we have annual experiences with implementing a influenza immunization program. And, the provinces and the local level have a lot of experience with that. But you're right in that the public health system is quite tapped out in terms of responding to COVID, but they've also lined up the additional resources required to deliver an influenza program. And through PSPC and with the provinces, more than usual amounts of flu vaccine have been ordered, with the ability to tap into some more if we needed. So that is a bigger supply than we normally have. I'm just trying to remember the numbers now. I think it's around 14 million doses, and which is bigger than what we had before, with some contingencies to get some more if we needed to. The federal government also is putting an additional support to get the high-dose flu vaccine to all long-term care facilities. Last year, not every province takes advantage of the high-dose flu vaccine, so just to sort of level the playing field and make sure our seniors are protected. And because we know that's where the pressure points are for COVID cases as well, we want to make sure, we protect our seniors. So actual federal purchasing and support for long-term care. But we also, together with provincial jurisdictions, know it's actually a really good rehearsal for, actually putting out the mass immunization programs we may need to do for the COVID-19 vaccine. So everyone is looking at this as a good, approach so that we can iron out anything else that we need to do from an implementation perspective. We've provided guidance at the federal level to how to run an influenza immunization clinic, for example, safely in the time of COVID as well. So those are just some of the key measures. We haven't had any issues in terms of delays, but we watch that really carefully because it's a biological product, and every year there could be changes. But as far as we know, that pipeline is going as it should.
Thank you, Dr. David. Follow up?
Yeah, and this question is for you, Dr. Tam, and Dr. New, if you want to weigh in. We've just learned that Bloc Québécois leader Yves-François Blanchet has tested positive for COVID-19. I'm wondering, given that Parliament is returning next week, what advice would you offer to MPs, especially when there seems to be some reluctance around virtual voting?
So I think, we provide public health guidance, but just like any other workplace or business, detailed plans need to be in place to ensure all of those public measures, the physical distancing, the hand hygiene, the mask wearing. You've seen what's happening around, the West Block here where we're doing this press conference. There should be options for people to be able to work remotely where appropriate. I don't know how the voting works, quite frankly, but, obviously reducing the amount of interactions and maintaining physical distance continues to be a recommended public health measure. And so I think the key is to make sure there are plans and people understand what to do if they are physically in the same spot.
Thank you, Doctor. Next question, Global News.
It's Michael Couture with Global National. For Dr. Tam, I wanted to ask you, it's been 6 months since we saw the devastating outbreaks in long-term care facilities. Besides those interim guidelines that were released around Easter saying that, among other things, workers could no longer work at multiple facilities, what concretely has been done to prevent another round of massive deaths at long-term care facilities?
So, of course, long-term care facilities they're homes to seniors and people who need a certain level of care. And it's a complex environment, but it is managed is by the provinces, but also some might be private sector. So working with that sector has been really critical to enforce, infection prevention control measures. So while we provide guidelines, it's very important for each of those institutions and working, whether they're in the public or private sector, to make sure the infection control measures from the screening of, people who go into the facilities, the ability to physical distance as needed, and be able to provide the kind of sanitation, hand hygiene, and other measures. I think the other aspects is, looking at the physical environment, and, we know that some of the cases are transmitted because it's very difficult to spot symptoms in certain populations. So have very low thresholds for testing, and anytime there's a case, test broadly and widely, including asymptomatic and people with any kind of vague symptoms, is one way of immediately stopping those outbreaks. And supporting the workers, you've just talked about that in terms of not just, it's really supporting low-wage workers who have to, take sick leave, and all of that is really important because we depend on low wage, as I said, often racialized women in particular. That's really critical to support long-term care facilities. Without them and without supporting them, you could get increased spread, but you could also run out of health workers to properly look after our elders. And so, I think the federal government primarily has been providing, I think, financial support, but it is up to individual institutions, etc. I have heard, if you go around the country, there's different measures being put in place, but I certainly remain concerned that probably not enough is being done in every facility, and every single of these homes need to really shore up their measures. I think what I have seen, though, and we need to watch this really carefully, is right now we're seeing a rise in cases. They've generally been younger population. We're watching to see if there's any increase in outbreak in long-term care. So far, there are some, and then they continue. But in general, the number of persons in each of those outbreaks has been much smaller than what they've been in the initial wave. So I think that's a good sign, but it's not a sign for complacency. So it tells me that people are acting fast and making sure those outbreaks don't grow rapidly, but take really good care of those populations.
Thank you. Follow up.
So I hear your concern, and I understand that the federal government may be limited in what it can do and impose on provinces. But what do you say to families who maybe have a loved one or a parent inside a long-term care facility, saw what happened in the spring, worry, now hearing your concern, are more deaths just inevitable this fall, and that we'll see a repeat because people are probably wondering whether or not they should pull their loved one out of the facility?
Well, I think, as I said, that everyone has learned a lot from that initial wave. And as we all know, much of the outbreaks and the deaths occurred in the two largest provinces. And so I think that it is not inevitable. It is, I think, with all of those measures, we should be able to keep seniors safe. But it does mean a concerted effort on everyone's part. The other thing to balance, in speaking with my colleagues in the province territories, they also want to make sure that we balance out the impact of families being able to visit safely, the mental health, isolation of the seniors. So I've heard of some innovation in how provinces are creating safe spaces for families to meet their all the relatives in as safe a manner as possible in these facilities. So really check out where the specific institutions as to what measures they put in place. But with the increase in testing, with all the different measures that we've learned that works to prevent outbreaks. I'm asking for people not to be complacent, but we know what works. And I do have, I think that people should be able to prevent these outbreaks. And they are smaller, as I've said, any of those outbreaks. So we just need to keep at it and keep strengthening, those measures. And with that, I think we could see a much, much better outcome than what we had in the first wave.
Yeah, it's Dr. Maybe I just would add to that. With all the things we've learned, I think two very important things have also, obviously become much more, known by everyone in terms of the science, and that is the role of, I would call it the asymptomatic transmission, as well as also the role of, we'll call it droplets, microdroplets, aerosols, and so on. And so certainly now everyone here, the use of face coverings and so on is well understood and appreciated, where it wasn't at the very beginning, because the science just wasn't there. We treated, I think, COVID-19, we thought it was similar to other, quote, respiratory infections like influenza. So with that, and of course also with the, I think the more stringent measures put in place by institutions in terms of screening visitors, the hand hygiene, all the protocols, that I think serves us in good stead in terms of preventing a similar situation this winter as what occurred last spring.
Thank you, doctors. Next question, CTV.
Hi, doctors. Mackenzie Gray from CTV News. In your opening remarks, you both said that essentially if the numbers don't improve right now, and as a quote, we could lose the ability to keep COVID at manageable levels. For both of you, what is a manageable level of COVID in this country?
So you have to balance the ability to detect and break those chains of transmission. So it depends on local public health capacity. So if you can imagine a single case, if you don't keep your contacts low, local public health may have to manage 50 contacts and try and find them, etc. So, the manageable means that everybody can do something right now to keep that in check. I've seen provinces hiring more contact tracers, as I said, increasing their testing capacity, but there's a finite sort of limit to that capacity. If the public does not assist with that, then you could lose that ability to do those rapid testing and contact tracing. And so those are the kind of indicators we'll be watching for, not just, cases going up and the fact that they're increasing, but we want to see that it doesn't continue and that it begins to sort of level off. If that doesn't happen, it tells us not just how virus is being transmitted, but it may give us a signal that there's the limit to the coping mechanism. At the moment, the cross-country checkup, as it were, is that people are managing, but it doesn't take much for people to be in these big settings for local public health to have to expend a huge amount of resources to do all those contact tracing. So it is not a straightforward single answer. It is actually quite different in different areas of the country. What the federal government is trying to do is that we may have to send in sort of rapid response mechanisms for specific spots if they're not coping. But so everything is being done to keep it at the manageable levels. The other indicators to really watch out for is the hospitalizations in the ICU. Those are low at the moment. But again, if there's any signals that things are increasing, it's another indicator that we might be going in the wrong direction. So really, though, from what I've seen at the national level, is that if we do something about, if everybody does what we know to be tried and true measures, this thing can, again, be turned around in terms of a de-escalation.
Thank you, Doctor. Follow-up? Oh, Dr. New?
You want to add anything on Dr. New?
No, not much to add. I think what Dr. Tam is really saying is that there are sort of two related systems, you could say, in my mind anyway, the public health system and the healthcare system, and they're both very interconnected. So from a public health perspective, certainly we want to make sure that that system isn't overloaded in terms of the contact tracing, unlinked chains of transmission. So everyone needs to do their part, because if we start losing control and just widespread sort of unknown ongoing chains of transmission and the numbers keep going up, hopefully not exponentially, that is a concern. And then, of course, related to that is sort of the health impacts in terms of, if you get more individuals ending up with severe symptoms and having to be hospitalized and ending up in the ICU, that's another, obviously, a serious consequence that we're trying to avoid. So I think between the public health system doing what they need to do and also preventing overloading of the healthcare system, that's what we're looking out for.
The general approach that both of you have taken and seemingly most of the provinces have taken is to essentially, after we dealt with the first wave, relax restrictions and then basically ask Canadians nicely to follow the rules. We've now seen that many groups of people, generally younger people, have not been following the rules, and that in some provinces we've allowed gatherings, in Ontario recently up to 100 outside, that would allow people to be in large groups, which would mean we'd have these larger transmission events. If the asking nicely is not working as it is not now, does that not mean that we then need to go the harder route, which is what we used the first time in the first wave, to have more strict regulations, to lock things down further, to avoid getting to a situation where we overload the healthcare system or get into an unmanageable situation like you were referring to before?
Well, I think there's a broad range of measures that public health at the different levels can take. I still strongly believe that getting the public empowered to do what they need to do is still absolutely vital. And the young people, I was reading about London Middlesex and Western University. Now, these highly intelligent young people, they, go out and socialize and in different ways resulted in a cluster. But you can learn from that, and that, I think that age group can innovate and still, learn to live with COVID-19 in safer ways, but not shut down that sort of environment and the ability for them to have to learn in the, higher education setting. So I still firmly believe that a cohesive society and the public is very important. However, local public health and certainly the province have, as you've seen, and I've been told by my colleagues that they want to keep that balance. They don't want to, go back to really restrictive measures. as much as they can, but they will do it if they have to. But the difference, I think, between the first wave and the next resurgence is that we want to be as targeted as surgical as possible. So not sort of blanketing the whole province, but perhaps looking at more local realities and seeing if more of these, restrictive measures need to be reenacted. But everybody's trying hard to not go there, but it is something that can happen. But the more everybody plays their part, the less likelihood it is that we're going to have to go back to restrictive measures. But yeah, no, the concept is that there shouldn't be, blanket approaches as much as possible.
Thank you, doctors. We have time for one more question. We'll turn back to the phone. Opérateur.
Merci. La prochaine question est de Lina Dup de la Presse canadienne. À vous la parole.
Question from
Oui,
the Canadian
bonjour.
Press.
Je voudrais revenir sur l'histoire de la seconde vague à
I'd like to
Ottawa.
come back to the history of
Maintenant
the
que la
Ottawa
ville
second wave.
considère que
Now
les
that the
autorités
city
de la santé publique dans la ville d'Ottawa considèrent
public health authorities
qu'on
in
est en
Ottawa
seconde vague et que le
consider
Parlement est
that
situé
we're in
à
a
Ottawa,
second wave
j'aimerais
and that the
entendre
government is
votre
located in
opinion
Ottawa.
sur
I
d'un
would
point
like
de vue de
to
santé
hear
publique
your
sur l'idée
perspective
que
from a public health point of view
338 députés et leur staff vont faire
regarding
des allers-retours
how
d'où ils sont
338
vers
MPs
une
and their
ville qui
staff
est
are
en
going to go
seconde
back
vague.
and forth
J'aimerais avoir
between
votre
their riding and a
évaluation du
city that
risque.
is in a second wave. Can I have your assessment on that?
OK, merci, c'est Dr. New. Merci pour la question.
Answer.
Ça, c'est une bonne
This is
question. Je
Dr.
pense
New.
que
Thank you. That's a
c'est
good
sûr que
question.
le médecin hygiéniste en chef de la ville d'Ottawa, Dr. Etches, elle est responsable
Etches
pour tous
is
comme les résidents,
head
les
public health authority in
citoyens qui
Ottawa.
sont résidents ici dans la ville, à la ville d'Ottawa. Et ici, on parle des députés
And regarding
du Parlement.
MPs,
D'après moi, ils sont aussi
Parliament,
comme des résidents de la ville. Donc,
they are residents,
si
considered
les
residents
députés
of Ottawa and public
font
health
des
guidelines in
activités
Ottawa
à l'extérieur
are
du
for
Parlement.
all residents of
Je
Ottawa.
pense que comme tous les autres résidents dans la ville, c'est important
I think that
de respecter les
just like
consignes
for all other residents of Ottawa,
des
it's
autorités de
important for
santé
them
publique
to
d'Ottawa,
respect
de
Ottawa public health
distanciation
guidelines,
physique,
including physical
porte de
distancing,
couvre-visage, tout ça, etc.
wearing a
Mais
face covering, etc.
on considère qu'est-ce qu'il faut faire pour travailler dans le contexte du Parlement.
Now,
C'est
regarding
plus une question
what must be
pour,
done
je ne sais pas peut-être en
for
français,
work in
occupational
Parliament.
health, c'est vraiment pour la santé des autorités qui sont responsables
The health
pour comment
authorities
ça fonctionne
are
le Parlement.
responsible
Donc,
for
les
occupational
autorités,
health
les
and safety.
spécialistes dans ce domaine, ils connaissent les mêmes
are
mesures de
experts in
santé
this
publique et c'est
field.
vraiment à
They
eux
know public health
de
measures,
faire leur évaluation des risques et
and
aussi
it is
gestion
really
des
up
risques
to
pour faire
them
des recommandations
carry out
pour les
risk
députés,
management
comment
and define
travailler dans un milieu
recommendations
ici
for
au
MPs
Parlement, dans
with regard to how
un
to work
contexte
here
pour
in
assurer
Parliament
la sécurité et la santé des
to
députés et aussi
ensure the health and
leur
safety
personnel
of members of
dans le
Parliament
contexte
and
du
their
Parlement.
staff.
D'accord. Moi,
Just answer a question
Juste un
in
instant,
English.
Lina, on va répéter en anglais.
d'accord.
It's interesting. The question was about what advice we would have for parliamentarians, MPs here. Obviously, because they're in the city of Ottawa, they work in the city of Ottawa, or at least Parliament's in the city of Ottawa, and the Chief Medical Officer of Health for Ottawa, Dr. Etches, has declared that Ottawa certainly is a hotspot, even as she says, in a second wave. My first reaction, thought is that certainly for MPs, when they're outside of the business of Parliament and they're actually, carrying on their daily activities outside of Parliament, they're just like any other resident of Ottawa, and they should certainly respect all of the public health measures with respect to social gatherings, if they go to a bar or restaurant, good hand hygiene, physical distancing, face coverings, all that should certainly be in play. When it comes to how Parliament itself functions, certainly I would leave that to sort of the experts in occupational health and safety in terms of what could or should be done within the context of Parliament. They certainly appreciate all of the tried and true public health measures, but how that's operationalized, how that's sort of undertaken in terms of the management of risk within the context of Parliament, both for the MPs but also for obviously their staff. That's something within the sort of the workings of Parliament that needs to be worked out to obviously to safeguard the health and safety of everyone.
Thank you, Doctor. Lina, question de suivi?
Oui, alors peut-être ma première question n'était pas claire. Je vous demandais pas quels conseils vous leur donnez à eux pour leur travail ici. Je vous demandais d'évaluer le risque pour le reste du pays, étant donné que ce sont des gens qui font des allers-retours vers une ville où il y a une seconde vague. Ils vont et viennent à chaque semaine, normalement, ou peut-être à chaque 2 semaines. Je vous demande d'évaluer le risque pour le reste du pays d'aller constamment en visite dans une ville qui vient de se déclarer en seconde vague de pandémie.
Merci pour la question. Ça, c'est peut-être un peu difficile à répondre parce que le contexte, c'est différent pour peut-être se parler de chaque député individuellement parce que je pense que si tous les députés suivent toutes les consignes de santé publique, c'est comme tout le monde, mais c'est sûr que les voyages, si ils font des allers-retours partout dans le pays, il y a un certain niveau de risque. On sait que même prendre les vols, il y a certainement une évaluation, une bonne gestion de risque. Qu'est-ce qu'on fait avant le vol? Qu'est-ce qui se passe dans les vols avec les couvre visage, tout ça, c'est quelque chose. Je pense que les députés maintenant sont sensibilisés. Je pense que quand ils sont dans leur conscription, c'est aussi important. Je pense que tout le monde comprend qu'il faut limiter, comme dit, peut-être les interactions, pas faire comme auparavant, se serrer les mains avec tout le monde, tous les personnes dans leur conscription. C'est sûr que le job d'un député, c'est vraiment de discuter, engager avec la population de leur conscription, mais je pense que si aussi ils suivent les consignes de santé publique dans leur conscription pour assurer la santé et sécurité de tout le monde, et faire même chose ici à Ottawa, que oui, c'est bon pour gérer le risque, mais en fin de compte, c'est pas vraiment pour moi. Je pense que tout le monde doit faire une auto-évaluation de leur risque et peut-être pour quelques-uns, c'est vraiment avec le voyage à distance, tout ça, peut-être c'est mieux, peut-être, travailler virtuellement ou peut-être rester ici à Ottawa. C'est quelque chose, c'est vraiment, il faut avoir des discussions, je pense, au sein des partis individuellement, mais aussi avec les experts ici de santé publique.
And it's important to take into
Est-ce qu'on peut répéter en anglais pour une autre fois?
Public health authorities guidelines.
The question was about what I think about the risk of MPs going back and forth. That's a hard one because certainly it might even come down to sort of an individual sort of assessment of risk for MPs depending on, where they come from, where they work. I'm just adding on to my answer in French, depending where their riding is, who knows what the activity, COVID-19 is compared to what it is in Ottawa. I think everyone's very sensitized that certainly you need to follow very, I think, scrupulously, if I can use that word, the measures for public health, both while you're in Ottawa, for anyone, but obviously for the MPs. Then also, if there is this back and forth travel, to also follow very strictly what is recommended in their local riding. I think all MPs certainly understand the work of MPs. It is to engage with obviously their constituents, to, as they say, press the flesh and so on. That was before, and I think now people recognize, and MPs, from what I understand, are not going around sort of shaking hands with everyone and having large meetings and so on. So I think their business has changed. But I certainly think also it's an option that should be discussed both within parties but also with the occupational health experts. For an individual MP, maybe with their own risk assessment and other considerations, maybe there might be the option of working maybe virtually or maybe even staying virtually from their riding or maybe working here in Ottawa. But that's not really for me to decide. All those things need to be part of a sort of a fulsome evaluation. Thank you.
Thank you, Doctor. C'est ce qui m'a fait la conférence de presse. That will be all for today's press conference. Thank you.
Thank you. Merci. The conference has now ended. Please disconnect your line.